there's 4 T's of risk. You can terminate the process that's causing it. That's the first thing you should do. The second one is to transfer that risk, treat the risk, and then tolerate the risk. That last one is what everybody's doing. They don't even know it. So if you don't do the first 3, you're tolerating all of it. You got to be very, very careful with, that last T, because as executives, when you sign off on the tolerate part, you better make darn sure you've done the first 3. And I'd say in that order, because, you could risk assess yourself to death, right? So you got to be very practical with how you do risk assessments.
Welcome to another episode of Zenix podcast with industry leaders. Today, we're very pleased to have Rick Moore with us. Rick, why don't you go ahead and introduce yourself to our audience?
Sure. Thanks, Kevin. I appreciate the invite and spending some time with you this afternoon. I'm a healthcare IT guy. Usually tell people I do all the things that clinicians don't like to do from an administrative perspective. And primarily, I work in healthcare IT with information security as my, I'd say, top skill set. And that's what I spend a lot of time doing these days as a fractional CIO, fractional CISO, Chief Information Security Officer, Chief Information Officer for several different companies. I spent 20 years in the military, retired in 2005. I had spent the last half of that time in healthcare as a medical service corps officer with a concentration in IT. Then went into the not-for-profit sector in 2005 and spent a couple of decades with 2 different not-for-profits, one the National Association of Children's Hospitals in Alexandria, Virginia, and then the National Committee for Quality Assurance in DC. And in both roles, I was both the IT guy, all things IT related, as well as all things information security. And for the last 4 years, I've had my own consulting group called MTC Group LLC, or More Than Consulting, and I do a lot of the fractional work that I just described. And I'm currently working with a business partner and teaming on building national programs for other not-for-profits that are in the same space, primarily health interoperability and digital measure reporting.
Well, Rick, we're so fortunate to have somebody with your background in our podcast so that we can get into a lot of the healthcare issues. One of the first topics of discussion for us would be, how do you balance the regulatory compliance in a world that everybody expects security and good care for the patients? How do you balance all of that? What are the challenges, and how would you say that you need to juggle all this in order to provide a comprehensive system in a very complex IT environment?
That's a very big, heavy-weighted question, Kevin, because it really depends on the type of care organization you're talking about. From a healthcare delivery perspective, a lot of what your, I would say, technical issues that you deal with or technical challenges you deal with from an information security perspective are up to your IT guys, right? The folks that are running your operations. So from an infrastructure perspective, getting the basics right, making sure you've got your technical protocols in place. And I think what folks miss quite a bit is just covering the foundational basics, right? Well, we're in the cloud now, so we just transfer all that risk to somebody in the cloud. Well, unfortunately, you might be able to transfer that risk, but it's still your responsibility to make sure it's done appropriately. So while the evolving landscape of going to the cloud is certainly a one that builds resiliency and is one that also builds other unintended consequences, it doesn't absolve the organization from sitting down and actually doing what I would call your table stakes kind of things, which is, what are our data flow issues and where is that data going and how are we protecting that data? It's all about the data at the end of the day, right? And you can put all the controls you want in place, but to your point, with this call for data interoperability, and I'm sure we can get into a lot of the regulations like around TEFCA, around information blocking particularly, and having APIs stood up throughout the industry now to go digital. It seems like it's in direct conflict with the need to keep it secure, but actually it's not. Meaning the need to get the information is necessary for us to deliver better care. And there are guardrails already that tell us how to do that in a secure way, right? It's your basic fundamental things. Who needs to know? How much of it do they need to know? And are we securely transmitting and securely storing it? Pretty basic stuff. But a business impact assessment, a risk assessment, is something that every organization should be looking at. And that's how you start to really, I would say, circle the wagons around what's really critical to you. So it's not an either or, like you said, the word balance. It's a matter of, can we do this thing, whatever that thing is, transfer the data, package that data, store that data? Can we do it securely, and have we trained our staff? I think that's the biggest piece that a lot of folks miss. Have we trained our staff? Because if you don't build the infrastructure, the workflows around that, and the tools for the staff to do it, they're going to go around it. And that's where you end up with all these problems, because your greatest risk out there is obviously the people. That's your 80% of your risk when it comes to breaches. We all know that. It's just mistakes that people make. And that's the target that everybody goes after, right? With phishing and all sorts of other social engineering type things. That's the weakest link in the security chain.
So what does, as a leader, have to do? Like, what's the role of a leader in this space? Because you mentioned a lot of things, which means leadership becomes a key in bringing all this together. As a CIO, CISO, their role is becoming more complex because the cloud, because the APIs, because of interconnectivity across a digital world. What do you think the role of a leader should be, and what are the challenges, and what should the leader focus on in order to balance it out?
Right. Great point. It is a leadership challenge, definitely, because leadership begets culture, should be the way it goes, right? What the leadership, and that's a broad term. I like to look at everyone as a leader, if you will, but in your own sort of lot or station in the organization. Let's just say the executive suite, right? Leadership. If you run your organization with an iron fist and penalties are the name of the game, you're probably not going to build a culture where people feel comfortable to talk about the risks. They're not going to feel comfortable talking about the near misses. They're going to feel comfortable coming to you with issues. That's rule number one. Don't browbeat your staff into submission that if they do something wrong from a security perspective, they're going to fry them in the public sector, if you will. We can't go that route because we know what that does. That creates people, their fear factor. So what you want to do is you want to create, like I said earlier, a program where the workflows meet the needs of the individuals. Obviously, the clinicians is a great place to start. Meets the administrative needs of individuals. Doesn't provide such friction or abrasion that they want to go around it, which some people refer to as shadow IT. I'll get my own system. I'm a VP down in this area. I'm just going to go buy my own system, and I'm going to do my own project planning over here, and I'm going to do my own chat GPT over here. That's another thing we have to think about, right? It's the shadow IT, because if you don't build as an IT guy, as a leader, if you don't build that into the expectations of everyone's workflow, guess what? They'll figure out ways to get around it because everybody wants to be efficient. They want to be more efficient typically, but they don't understand the downstream impacts. And I think as leaders, some of the missteps that we've done particularly in IT is not focused, again, like I said earlier, it's about the data. So having those information governance structures overlaid on top of your enterprise so that everybody understands that if we say a patient is defined this way, it's defined that way across the entire enterprise spectrum of your systems. Because once you start adding more systems on, like I was saying before, whether it's shadow or approved enterprise system, if you don't have common vocabulary between the different systems, you end up creating your own unnecessary silos because it's done one way in one system and it's defined another way in another system. To get your enterprise working really well, and even with security, because if you define things the same way, guess what? It ends up the same thing in each place that you store it. If you define it differently in different areas, you might not realize it's also PHI, but it's just called something else. So you have to be very cognizant of your data flows, which beget workflows or vice versa. Those go hand in hand. The validation of that input, which is part of your data governance. Like, how do you define an address? What elements of an address are we looking for? Does it have to have zip code with 7 or is it 9? At the end of the day, you have to come down to this level of atomic, I would say, agreement and build up from there. If you hone in on your center of gravity, what is the most important data elements? And we're doing some of that with regulation, which goes back to your question about balance, is how much do you regulate and mandate, if you will, and how fast do you do that? Because how many legacy systems are going to break if you mandate them out of it? There is this desire to be more lean and mean and efficient in healthcare, but we're also talking about a 60 to 70-year legacy of systems that were built for billing. And we're slowly over the last, I'd say, 10, 15 years, trying to move more towards, we're trying to deliver care, and we need to document the things that get us to a learning health system, not a billing health system. That is part of what's the challenge has been in healthcare, is that we have focused on data to pay bills or to get revenue, and we haven't really focused on how to learn, how to improve the quality of the care that's being delivered. And that's where a lot of the friction has happened with the EHRs. And that's why you've had a lot of the shadow IT. And of course, the information blocking that's gone on that some would lean on HIPAA security protocol, like minimum necessary, and those kinds of, I would say, well-intended regulations also are being used as ways to not share information. And that's not helping either. And I think the biggest issue we have in healthcare when it comes to data is we don't have a national patient identifier. We need to have all actors within the system, the data system, that are easily identifiable across the enterprise, within your enterprise and external to the enterprise, if we truly want to get to an interoperable healthcare system.
Yeah, interoperable. That's really an interesting topic that I want to dig into a little bit more, because when we look at the multi stakeholders and in the healthcare ecosystem, it gets really complex, right? And then on top of that, you have to put compliance, regulatory compliance on top of that. What are the challenges of creating this interoperability beyond data governance? Meaning that, yes, let's say that we've got data governance the way you described it, but then now you've got multiple of stakeholders, whether it's administration, clinical, the partners, the insurance companies, so on and so forth. There's many, many stakeholders in this. How do you make this ecosystem come together? What are the challenges in making it work?
Another great question in terms of trust. Actually, I would just come down to one word. It's all about trust. And healthcare data moves at the speed of trust, really, at the end of the day. And you probably know this if you had to connect one system to another system to exchange that trust. And I think where people fall short a lot of times is they use either federal mandates or other trust building activities as check boxes as opposed to strategic opportunity. And a good example would be, let's say you're an organization that is a covered entity that does what the minimum requirement is, which is call it a risk assessment. I think an annual risk
Yeah.
assessment. Okay. But you don't go the extra step, the extra mile to understand that having a third party review of what you're doing helps bolster the trust of those agencies that you're trying to connect with or work with, right? Even TEFCA is a good example where the rules around the TEFCA, I wouldn't call them mandates so much because it's voluntary, but the TEFCA on ramps is that you agree certain standards that you will actually conduct and move and receive and change information. Those are the same kinds of guardrails that information security frameworks provide. So if you go through that process of getting your processes reviewed and validated by a third party, that bolsters your position with external clients because it's like, oh, somebody else looked at that, audited you, and you've actually gone the extra step to build confidence within your own self, demonstrating your own due diligence for securing data. So if you're going to engage with me, then I can at least go off of the fact that you've taken those steps and those measures and you've actually had others look at you. And you can demonstrate that with artifacts. And so there's these things that are coming out, and I work with companies all the time around this. There's a lot of them will do it, as I said earlier, just to check the box, just to get the mandate done. And that's a very short-sighted perspective. Yes, you could go that route, but it doesn't necessarily, and I use that extreme, I would say, use case. It doesn't necessarily build the kind of culture you're looking for internally because it's just a checkbox exercise for people. And that's where it just feels disingenuous. If it's part of the culture and it's part of what everybody expects and everybody's part of that team, it's not just an IT project or, information security project off to the side. How that culture is built within an organization manifests itself in how that organization represents itself to other organizations. And I think that's the kind of trust that's needed. And a lot of healthcare, particularly those that are not healthcare delivery, but the ones, the BAAs, so the business associate agreement type organizations, they're the ones that are really probably doing more of that than even the covered entities go through because it's not necessarily a mandate for them to have to go to that level of review. Yeah. However, on the extreme side of that is that covered entities then hold their BAAs a whole lot more accountable in many ways than even they're holding themselves accountable. I've seen a lot of information security questionnaires that come out from these organizations, but yet themselves, they don't even put themselves through that
Yeah.
same rigor. It's an interesting problem to have in healthcare. Everybody assumes, wrongfully or rightfully, that everybody knows that they're supposed to do the 10 big things, whether that's encrypt at rest, encrypt in transit, assign a security officer, assign a privacy officer, have an incident reporting breach capability, do your risk assessments, do your business impact assessments, and make sure that you're doing a vulnerability and pen test and keeping your infrastructure updated, right? With security patches and stuff like that. Those are, there's like 10 things that you should all be doing. Everybody's like table stakes. And then there's, okay, now let's hire a red team to come in here and try to hack into it, right? Or let's hire some phishing experts to come and do social engineering to, really train our staff. That's going the extra mile. And that's the kind of thing that builds more trust, is going the extra mile.
100% agree with you. But when you think about this, are there any instances that this focus on security and also going the extra mile has paid off in the past and it really showed how important it is to do that? Can you think of an example that you could share with our audience?
Yeah, sure. Whether or not your insurance, so everybody knows about cyber insurance. A lot of cyber insurance companies will rate your level of risk based upon how serious, going back to our discussion here, how serious you take security. Like, do you do all the 10 things I described? And a lot of those insurance companies some of them won't even cover you if you're not doing the basics. They don't even give you a right. So there's one positive outcome of doing these things. The other one is some have actually gone on and given discounts to having a certain level of secure, let's say, a third-party independent audit review or attaining SOC 2 or attaining high trust, whatever that might be. There's all types of different incentives. So look at that as a strategic incentive to have that third-party reviewer look at you and see if there are things you can get discounts on, if you will, for being at a higher level of security. The one thing I do know is that the Officer of Civil Rights, if you do have a HIPAA breach or an incident, and you have done your due diligence to the level I've described it and can demonstrate that through the artifacts, whether that's certification or otherwise, I do believe that they look at that, the Officer of Civil Rights, that if you had a breach, not a safe harbor per se, but there would be some consideration in how they penalize you for that breach, whatever that breach may be, whether it's a organizational led breach or whether it was somebody who was nefariously acting inappropriately within your organization and selling things, which would probably be one of the most egregious things. But yes, I do. I have heard where the Officer of Civil Rights, not that I've been involved in any of them, but I've heard where that was taken into consideration during what I would call the penalty phase of the breach that did occur. And in fact, one such organization that has a framework around security, may be known to a lot of your listeners, is High Trust. And they put out some statistics that show that I think it's 99.4% or 99.5% of the organizations that carry the High Trust certification have not had a breach. Now, that doesn't mean they haven't had an incident. I said a breach, a reportable breach, right? So they're not on the wall of shame. Now, I say that, and there was one big organization, you may have known, Change Healthcare, that was High Trust evaluated. Now, I say that, and I want to make sure I put that in proper context. It's not known. I wasn't able to find definitive research or affirmation that the breach that they had, or the issue that they had, was related or directly related to the thing that they were certified on. So let's be very clear. You can have a certification organization wide, or you can have one system. It's particularly with High Trust, that's basically just a system. So it's unknown to me, and I couldn't find research to support whether the breach that happened at Change was directly related to their certification or not. Point being is, there's indication to your question that those organizations that go through a due diligence framework, whatever that is, whether it's High Trust, SOC, NIST, ISO 27001, or the like, those standard frameworks are those organizations, from my perspective, they are far more better off when it comes to demonstrating their due diligence than those that don't. What I can find, though, is, does it mean they won't have a breach? Does it mean they don't have a breach? I can't find definitive evidence for you there. And I don't have any data that shows that, well, because they had the coverage that they had, the due diligence coverage, that they avoided a certain penalty or that they avoided a certain cost. I would venture to say that when a breach does occur, whether you're certified or not by a framework provider, there will be expenses, there will be reputational loss that are unavoidable. But I do believe that it's like the old adage, you don't know what you don't know until you go through it. You could say, well, I've never had a third party independent review, and I've never been breached. Well, I think there are two kinds of companies in the world that I'll borrow from someone, I believe it was an FBI director, that said there are those who've been breached and know it, and those that have been breached and don't know it. So I would venture to say I would not want to be in the second group and not know it, because I do believe that once you go through a framework, whichever one you want to pick, and you do your due diligence, you're more probabilistically going to find the kinds of risks that you should be finding and closing those holes. If you don't do your due diligence and you're just getting lucky, well, I think it's just because you don't know. That's a whole nother.
Such a great point, because one of the areas that we've experienced is that when we say, okay, go with Nest or any of the frameworks and do the work. Oh, I don't need it. But it's precisely that when the controls are in place, you're in a much better place. You could see the results of it, but it does not guarantee that there's no silver bullets.
It's just a probabilistic, I would say. In the world of risk, there's really only four things that, the way I explain it to my clients, there's 4 T's of risk. You can terminate the process that's causing it. That's the first thing you should do, because there's no sense in perfecting that which should never be done. So why protect something if you don't have to do it? So if a process is creating a risk, then terminate that process or change that process to eliminate that risk. The second one is to transfer that risk and transfer it to a third party. For example, AWS, you want to now host everything in the cloud. Okay, great. But if you don't set it up properly, you're no better off than you were when you were hosting it in your own environment. So you have to be very cognizant of the fact that you can transfer the risk of, let's say, the resiliency part, because now you're on a more resilient architecture. But if you don't set it up correctly, you've just created the unintended consequences that you thought you were solving. So be careful with that second one. Another good example of transfer would be to buy cyber insurance, so to speak, right? Yeah, that's great, because that's to protect you after it does happen. Then you have at least some financial supports there, right? But it doesn't absolve why it happened. So that's a whole nother discussion to have. And that gets to the treatment part. So what do you treat things? And treating is really important, because this gets back to the framework selection. And this is what I tell people a lot, different frameworks that are out there. Some could have as many as 100 controls, which are what I would call at least the basics, and then some. Like High Trust has 3 different levels, right? There's the basic, right, which is the cyber. Then you get into I1, and you get into R2, and I'm not going to go into all the details, but there's different levels of depth that they go into. Then there's SOC 2, which is really more around the operational capabilities of an organization, which I think is a layer that I would look at depending upon what type of an organization I am in this, what I'm going to call ecosystem. There's covered entity, there's BAA, there's vendors, there's different aspects, and you may be a fringe, let's say, data feeder. Maybe you're doing analytical reporting and you've got this wonderful quality reporting tool or something. So you're getting data and you're in the game, but which framework should you use? How in depth do you need to go? Are you getting all 18 elements of the PHI? Well, you're probably very high risk then. So you might want to think about that. So limit the number, terminate what data you're getting. So maybe you don't need that all. There's terminate the process, transfer the risk, treat the risk, and then tolerate the risk. That last one is what everybody's doing. They don't even know it. So if you don't do the first three, you're tolerating all of it. So you got to be very, very careful with, that last T, because as executives, when you sign off on the tolerate part, you better make darn sure you've done the first three first. And I'd say in that order. And I usually coach all clients, and that's how I approach their due diligence when we get to the risk assessment part. Because, you could risk assess yourself to death, right? So you got to be very practical with how you do risk assessments because, who would have thought we would have had COVID, right? That's a huge risk to a lot of organizations.
Yeah. So let's change the topic a little bit. AI.
Off to work we go.
Literally, there's not an hour goes by that I cannot, that I don't hear from somebody about AI. So what do you think the AI impact is on trust, data integrity, and cybersecurity? How do you protect against all the attackers that now use AI?
Oh, man. Oh, boy. So great topic. It's another huge deal going on in the industry. It's disrupting everything we do. And I would call it, there's the promise and the peril. And I've heard that term used several times. I think the promise of AI is the efficiencies gained. I use it every day. It's a wonderful, I always tell people it's like having 10 MBAs, at my disposal. I can just go in and start, conversing with a research assistant really quickly and do research 10 times faster than I was able to do, let's just say 3 years ago. So it's really mature in that regard. I think the agentic AI is going to really bring about some of the interoperability issues. For example, I can see endpoint AI agents helping manipulate the data protocols that are missing, like proper semantics, proper syntax, proper formats, and things that are missing in a lot of the data interoperability. And maybe someday, who knows, maybe it will be so easy as plug and play. That's the idea, is that we can just plug and play with each other on the data side, right? But today, to connect to another organization, it's weeks, if not months in the making, just to get the paperwork done, right? To connect to somebody. So I do see AI helping that whole process out because a lot of it is administrative. So if you built your perfect AI agent on your end and it had all your business rules in it for what you meant to connect, and the other agent AI was able to meet all of that in a digital way, as you can envision that, I see a huge lift. And I also see within healthcare, we have a data problem that I was describing earlier, data governance. If you could build that data governance into an AI model within your own, and that's where the beauty of this is, using AI internally to then right the ship. Instead of ripping and replacing your legacy system, why don't we just put a middle tier in there with an AI agent that's basically doing all the mapping in real time, learning all of your idiosyncratic processes that you have, and then pulling that data from the places you already store it that already work for your workflow. Okay. And mapping that to the data standards like USCDI or others, I see a world where that can happen. On the flip from security, I see the same thing with security where AI can help you detect real quickly in real time and avert 0-day let's say attacks, things of that nature. I see AI being fantastically useful for that. And I'm sure it's already happening in some regards. And I've seen some, because it's so evolving every day, as you said, Kevin, I've seen product out there doing it. I haven't used it yet, just to be very clear, because I'm not in an organization on a daily basis, but I've seen product come out and I've seen product roadmap and I've seen some demos, and I'm actually having a couple this week. I see a huge efficiency gained with that side of the AI. On the peril side with security, I also see, and we've already heard news, that AI is going to be used to get more sophisticated attacks. And in fact, a good friend of mine was doing some analysis the other day. If you just go back and look at the data breaches we had up to this point, let's say since 2014, we've had some massive data breaches. Think of the millions and millions of records that are already now in the dark web that can be bought and used with AI, and how fast they can come in and then start doing a launch attack with all this information. So I think the peril of AI and the promise of AI hold equal footing in some ways. Some would say the peril is probably a little bit more powerful than the promise. But at the end of the day, we know it's here. It's like everything else. We can't avoid it. We got to address it. And to me, it goes back to the basics. Again, AI is only as good as the data it's fed in many ways. So if you're feeding it crap, you, you might end up getting crap back out.
Yeah.
So be very, very cognizant of the fact that your data problems won't go away. You can't just lay AI on top of that, but you could use AI to help fix that.
Yeah.
That's where I think the promise is.
So now let's put it all in one mixer. What are the challenges that healthcare organizations are having today that are on top of the list? And what are the potential solutions to those very important challenges?
Yeah, that's a heavy, heavy topic for folks out there, and I do not envy CIOs, CISOs that are in care delivery organizations right now. I do not.
Yeah.
What little hair I have left would probably be gone if I were in one of those roles at the moment. I would say first and foremost, design for provenance and interoperability. In other words, design with that in mind. I think a lot of what I said earlier, we design systems for billing, but now we need to design where the data are within our systems, where it came from to get in our systems, and is it interoperable as we move forward? Because the downstream impacts of having no data governance and just putting data wherever we want, we're feeling that now. Right. And so some of those architectural decisions are coming back to haunt us. So with things like fast healthcare interoperability resources, FHIR, as that has become more now the de facto standard and it does permeate our fabric, it's going to be a wonderful gain into the interoperability system. And you can't do all those things. You got to make governance a first, not a last thing you do. So part of that is overlaying governance, which gets you to your provenance and interoperability. And I would say adopt a zero trust and segment sensitive workloads. For example, when I said earlier, when you're doing your business impact assessment, where is the sensitive critical data at? Make sure that you're tight around that bullseye target. Don't try to eat the elephant all at once. Get that bullseye target of your most critical data and start there. And then concentric circles will build outwardly, and those other workflows will benefit from that. And when you're doing, a lot of people think, well, data governance equals operational governance. I think they're closely related because if you have good data governance, it should feed better operations because those anomalies that you introduce from a poor data governance manifest in operational governance. So those two go together. So if you're doing data governance, you better do operational governance at the same time, which is basically workflow, right? If you do that together and you validate the input on the back end, then your AI is going to be that much more robust when it comes to helping you make generative AI or predictive AI analytics. Don't forget, and this is where people mess up big time, invest in the right people to get the right skills and to keep them sharp. Training them on AI and how to use it and when it's good and when it's bad and how to, and this is my concern as somebody who's been in the biz now for about 30 years, is my lens, okay, when I see something come out of AI, I go, In other words, I can go, now there's some hallucination going on there. But there's a lot of folks that just take it for, hey, okay, boom, ChatGPT said it, so it must be right. So you have to have staff that are trained and understand how these things happen because those that know how to use AI are going to be 10x faster and better than those who don't. So when people talk about, well, AI is going to take my job, well, yeah, if you don't know how to use it, I would say that's probably very true. But if you know how to use it and you know how to be more productive, just like any other tool that we've had in the world, technology, whether it's a computer, and I can remember back in the days when I started my life, computers weren't as ubiquitous as they are today, right?
Yeah.
I think the first PC that I recall, dating myself here, but when I entered the job market in the 80s, I don't remember having a cell phone. So I think pagers were all the rage back then. But my point is, you have to take your staff because you got your Luddites that are still out there, believe it or not, and you've got your native born digital. I look at my grandkids now, it's like every one of them from the age of 13 down, they're digital natives. They all were born with a mobile device in their hands, whether it was an iPad or an iPhone or both. And of course, don't ever forget, because we're in healthcare, plan for regulatory change because it's coming and it's going to keep coming. So you always have to have that when you ask me this question, so what are folks supposed to do to build this out? Is you have to think about the regulatory change that's coming and be a part of the conversation. Because if you're in it, you can help navigate what actually comes out of it. And I encourage those that are in positions of influence to get in the game and help us make the transition from where we are to where we need to be.
Well, this was an absolutely wonderful conversation. Thank you very much for all your insight. I learned a lot from this conversation myself. I really want to thank you,
Same
Ray,
here.
for joining us today. And I'm sure the listeners will enjoy just as much as I did. Thank you very much for your time.
Sounds good, Kevin. Thanks for having me.